Thank you for coming back to the office today, Betty. I just wanted to follow up with you about the new medication, valsartan, that we started you on during your last visit. It might sound more familiar to you by its brand name, Diovan.
Dr. Stanley, I know I have to take it to help manage my blood and reduce my blood pressure. What is that word again for it?
When you have high blood pressure, you might have heard it called hypertension. Your Diovan prescription helps to manage this, as well as reducing your risk of cardiovascular death, and also the need to be hospitalized because of complications with your congestive heart failure.
Oh my, it does that for me too? Wow. Does it have a lot of side effects that come along with taking this? I don't have any time for problems right now.
All medications come with risks, Betty. Since you're still in your 30s, you need to know that Diovan is a pregnancy category C medication during the first trimester of the pregnancy, and a pregnancy category D during the second and third trimesters of a pregnancy.
And what do those letters mean?
Well, Betty, with drugs that have a pregnancy category C rating, it means that the medication's risk to the fetus is unknown, but there has been testing on animals that give proof that there have been effects on animal fetuses. With drugs that have a pregnancy category C rating, it has been confirmed that there are reports of harm to the human fetus, and it should only be used in situations that are life-threatening or when other medications are no longer effective. In your case, we would not want to use this medication. Are you planning on having more children? If so, I'd like to try you on a medication that will have less risks, just to be safe.
What? I already have 4 children. No more babies for me. That's what's probably gave me high blood pressure in the first place, because I always chase them around the house. Dr. Stanley, I won't be chasing any more babies. My husband got snipped.
Well, that's one less thing to worry about then. There are some other side effects that you need to be aware of. These include dizziness, anxiety, depression, hypotension, which means a drop in your blood pressure, an upset stomach, or elevated potassium levels.
Elevated potassium, what does that mean?
It means that there's too much potassium retained in your body. Have you noticed having any of these side effects since you started taking Diovan last month?
No, I don't think so. Don't I want hypotension? Isn't that why I'm taking my pills to lower my blood pressure?
While your medication is used to lower your blood pressure, this side effect occurs when your blood pressure drops too quickly. We want your blood pressure to stay within normal limits, 120/80 or lower.
Wow, I'm just learning a lot of new things. What else should I know about this medication?
Let's go over a few important things that you should remember. You need to make sure that your medication is taken as prescribed. If you miss a dose, make sure that you're taking it as soon as you remember, but not too close to your next scheduled dose. And never double up on your doses if you miss one.
I can follow that.
You also need to make sure that you're avoiding foods that are high in potassium, like bananas, green vegetables, salt substitutes, and you also need to follow a low sodium diet.
I think that's pretty easy for me. I hate salty foods, and I don't like the taste of bananas or spinach.
Okay. Another thing that I want to remind you of is that you need to make sure you're changing your position slowly when you're getting out of bed or out of your chair so that you don't have a sudden drop in your blood pressure. It can cause you to feel woozy or dizzy and fall. Make sure to let me know if you start having any of these side effects that I mentioned today.
I can do that. My sister's a nurse, so she'll help me watch out for them.
Great. Keep up the good work. While you're managing your diet, exercising, making sure you're not taking in too much alcohol, and watching your blood pressure, you're on the right track to managing your blood pressure.
Okay, thank you
Have a
very
great
much.
day.
Thank you.